Good day to everybody, to all students. Today we are going to talk about ALS algorithm for the treatments of cardiac patients. And this is based on the current guidelines published by National Committee of Resuscitation Training Malaysia, launched in year 2016. And these guidelines are based on the guideline from International Liaison Committee of Resuscitation published in 2015. These are the few updates on the guidelines which you need to pay attention to. Now, we need to focus on three algorithms in managing a cardiac patient. The first one is the algorithm on cardiac arrest, followed by the algorithm on tachyarrhythmias, and the last one is on bradyarrhythmias. We will go one by one. But before we focus on those three algorithms, I need to remind you to remember the basic life support algorithm as part of the management in ALS. Please do remember the DRS-ABCD approach for basic life support. Now, the first algorithm is the one used in cardiac arrest patient. After your basic life support, when the patient is not responsive and no breathing, you will start your chest compression. Connect the patient as soon as possible to AED or defibrillator once available. Recognize the rhythm, either it is a shockable rhythm or non-shockable rhythm. A shockable rhythm is either VF or pulseless VT, while the non-shockable rhythm are systole or pulseless electrical activity. And shock the patient with 200 joules if it's a shockable rhythm, while continue with chest compression for a non-shockable rhythm. You can start the adrenaline 1 mg early in non-shockable rhythm and continue to give every 3 to 5 minutes, while in shockable rhythm, you can add adrenaline after the second shock and amiodarone bolus after the third electrical therapy, and the second bolus of amiodarone 3 to 5 minutes after. And do remember to find the 10 reversible causes. Bradycardia patient will always present with pulse less than 60 beats per minute. When the patient arrives, you need to assess the patients and manage as per ABCDE approach. Acquire the 12-lead ECG as soon as possible and get all the vital signs. Now, assess the patients to look for signs of instability such as either the patient in shock, syncope, have a signs of myocardial ischemia or heart failure. If one of the signs is present, the appropriate treatment is electrical therapy, which is a transcutaneous pacing. If stable, you can start patients on drugs such as atropine as first line to a maximum of 5 mg. And the second line treatment is adrenaline or the alternative drugs such as dopamine, aminophylline, glucagon, or glycopyrrolate if available. The last algorithm is tachyarrhythmias. This is the most complex, but I will try to make it easy for you. Do remember, patient will present to you with pulses more than 150 beats per minute. Assess as per bradycardia initially and look for signs of instability. If it is unstable patient, the electrical therapy is mandatory in where you can deliver in synchronized cardioversion. If it is stable patient, the pharmacological therapy is indicated. The type of drug chosen is now based on the size of QRS complex, either it is broad or narrow, or the regularity of the rhythm. So now you can have to look into what types of rhythm based on these two criteria. There were only few types of tachyarrhythmias that you need to know. Please remember the size of QRS and the regularity of the rhythm to divide the arrhythmias. For example, if the QRS size is narrow and the rhythm is irregular, then it is atrial fibrillation. I suggest all of you to remember the algorithm by heart, as this is very important in the management of cardiac patients. Thank you and have a good day.